everybody to scan the QR code or sign in on the iPad. If you haven't already, you can do it at the end of the lecture on your way out. And then we've also got a few flyers over there for the YB Fit office. They offer health coaching and a variety of other health related services. So just wanted to give a little plug for them. Our speaker today is Mandy Christensen. She is an adjunct faculty member and internship coordinator for the Department of Exercise Sciences here at BYU. She's been in this position for the past 5 years. She received a PhD in exercise science from Brigham Young University in 2004, after which she took a 13-year sabbatical to be a stay-at-home mom with her 4 children. She's married to Devin Christensen, a systems administrator for the BYU Kennedy Center. She enjoys hiking and camping with her family, taking naps, and correcting her children's grammar.
So Devin Christensen, who gave the prayer, is my husband. So thank you for that prayer. And I would like you to call me Professor Christensen at home. Okay, so today I hope I can give you something that will be helpful. I hope this can be a message of hope. When we talk about exercise, we always feel bad about what we're not doing. And I hope we can have this can be a message of hope for what is possible, and kind of flip the script a little bit. I really like this quote that's attributed to someone said it wrong. Now I can't. Hippocrates, he said, walking is man's best medicine. And if you get nothing out of this little lecture, maybe it will inspire you to walk a little more. And every little thing you do counts. And we're going to talk about that as we go through. What walking really is, it's really good for you. Exercise is really good for you, but sometimes we put exercise in a category where it has to be hard, and we have to be overwhelmed, and we have to be sweating, and we have to push ourselves to the limit. And hopefully, again, I can share a message of hope where we can have more of a physical activity approach, where we find things that we enjoy doing that get our heart rate up and that move our muscles. And they don't have to be so structured and so hard, because everything we do when it comes to physical activity counts towards our health. And so here's just a quick overview. What we'll talk about the benefits of exercise really quickly. Then we'll answer a great question. How much exercise do you really need? And then we'll go on and give a little bit of exercise prescription and talk about how do we determine intensity of exercise and why that's important. And then at the end, this is an area that I'm very much interested in, is how do we use exercise to improve the different disease conditions that many of us start to experience as we age, that many in our modern society, the chronic diseases. How do we use exercise to prevent those, and how do we use it even to treat those diseases? Why is that little thing on? There we go. So why should we exercise? What are the benefits of exercise? Uh-oh. There we go. Okay, so there's a lot of them. And all of this comes from the physical activity guidelines for Americans. And it was a program published by the government about 3 years ago, just kind of outlining what the benefits of exercise are, what you need to do. It's a great set of guidelines. If you want to look it up online, you can find a PDF of it. But here are some of the benefits. It lowers your risk of dying from a heart attack, but also all-cause mortality. It lowers your risk of dying from anything. And so you live longer and you avoid a premature death. But even more importantly, I think, than living a couple years longer is your quality of life. And so exercise can lower your risk of disease. So it can both lower your risk of getting that type of disease, and we can also use exercise to treat some of these diseases. So the diseases, the chronic diseases up here, cardiovascular disease, high blood pressure, high cholesterol, type 2 diabetes, even cancer. There's a lot of emerging research with exercise and physical activity levels and cancer prevention and cancer treatment. And there are 7 cancers listed here. All of these, there is strong evidence that the more physical activity you engage in, the lower your risk for these 7 cancers. Exercise can help with our brain health. And so dementia and Alzheimer's disease, we'll talk about that at the very end of the lecture. It can help with mental health, reducing depression, anxiety, cognition, improving cognition. And so obviously with mental health, no one's going to say don't get the help you need and just exercise. That's not what we're saying, but we could certainly use exercise as an adjuvant therapy to some of the other therapies to help with the treatment of those diseases. And then, of course, this is very important to me, better sleep. I'm not very pleasant to be around if I don't get enough sleep. And if I don't get enough physical activity, I don't sleep well. And so that can improve someone's quality of life. Better sleep, weight control, better ability just to move and do the things that you want to do in life. And then as we age, our risk of falling increases as we lose balance, as we lose coordination, as we lose muscle mass. And it really is falling that for a lot of people is that event that takes them from being independent and independently living to a state of being needing a lot of assistance. And so we can lower our risk for falling, and we can lower the risk of disease if we fall. Not disease, but lower the risk of injury if we fall. And then the last benefit here is improved bone health. And as women, we all need good bone health. I don't know why this is weird. Okay. So you've probably heard this exercise is medicine, and that was kind of the title of my lecture, using exercise as medicine. And exercise is medicine is a phrase that was coined by the American College of Sports Medicine. It's probably been about 15 years since they did that. And it's an initiative to try to get exercise into our healthcare system so that primary care physicians, primary care health providers are using exercise as a treatment when we're talking about disease. And when we look at this list of diseases, it's by no means an exhaustive list, but these are some of the main disease categories that are what we call non-communicable chronic diseases. And there is strong evidence for all of the different diseases listed up here that exercise can prevent it, exercise can help treat it. So psychiatric diseases, I've already mentioned that, neurological diseases, metabolic diseases. The big one here is type 2 diabetes. A lot of individuals have type 2 diabetes. Exercise can be very beneficial with someone who has type 2 diabetes. We've known for a long time how important exercise is with cardiovascular diseases. Every major hospital has a cardiac rehab center where individuals who've had a heart attack exercise. They as part of their rehabilitation. And that's really kind of the historical beginnings of exercise medicine. And it was with cardiovascular diseases, pulmonary diseases, musculoskeletal disorders, autoimmune diseases, and even cancer are some of the diseases that we can use exercise with. Okay, so let's answer our question. How much exercise do we need? Does anybody know the answer to this?
At least 150 minutes a week.
Tammy, thank you. Now we know you agree. So again, this is from the physical activity guidelines for Americans, but this is something that's been recommended by every major health organization for a couple decades. 150 minutes of moderate intensity exercise. And when we say moderate intensity exercise, I use exercise and physical activity interchangeably, but I shouldn't because they're really two different things. So this is any type of activity where our heart rate gets up and we're using major muscle groups. And so, you know, that could include bicycling and swimming, you know, traditional types of exercise, running, walking, but it can also be gardening, anything that gets our heart rate up and uses major muscle groups. So 150 minutes a week, or if you prefer vigorous intensity, you only have to do 75 minutes a week. So you do the math, that's 30 minutes, 5 days a week. Now that doesn't sound like a lot, but that actually is a lot, especially if you're not doing anything right now. To go from 0 to 60 miles per hour, to go from 0 to 30 minutes, 5 days a week, is a huge jump. And so my recommendation to you is don't make that huge jump, because all you're going to do is hit a wall and think, I hate exercising, I hate doing this. It's a major lifestyle change. And so you need to approach it a little at a time, by small and simple things, a little bit. So that's the recommendation for aerobic activity. But it turns out we have muscles too that need strengthening. And so 2 times a week of some sort of muscle strengthening activity is also recommended now. And they didn't used to recommend this. We just used to care only about aerobic exercise. But the more we learn about muscular fitness and how important it is to your health, we now understand that they're both equally important to your health. So at least 2 times a day, or not a day, 2 times a week of muscle strengthening. And that can be lifting weights, or that can just simply be calisthenic type exercises, push-ups. Maybe I wouldn't recommend push-ups, but air squats, jumping jacks, walking in place, running in place, just any type of muscle strengthening activity.
Yoga, would yoga?
Yoga, yes, yoga, tai chi, anything that where you're using your muscles and you're strengthening them. Yes, yoga would be excellent, because you're also adding flexibility into the equation. But that's the recommendation. So now let's answer the question, how much do you really need? And again, this is from the Physical Activity Guidelines for Americans. And this graph here is a compilation of many, many studies. It's a meta-analysis. And so there's a lot of data represented by this graph. And so what we have over here, and I can never remember what axis that is. That's the Y. Yes, thank you, Devin. That's the Y, and this is the X. On the Y axis, I get nervous. I forget dumb things like that. We have the hazard ratio or mortality. So this is a way to measure your risk of dying. And we choose 1 as our reference point. And so anything lower than 1 represents a reduction in that risk of dying, that hazard ratio of mortality. And anything greater than 1 would represent an increase in the risk. And then down here, we have leisure time physical activity. And this is measured in met hours per week. I won't go into explaining what that means. But when we look at this graph, we can see that about that 150 minutes, which is the recommendation, we're about here on the graph. And so what this means is that an individual who exercises or has physical activity for 150 minutes a week has a 30% reduced risk of dying compared to someone who's not doing anything at all. That's a pretty dramatic reduction when we're talking about hazard ratios. But what is most exciting, I think, about this data is that there's a steep early slope. And so you don't have to do very much to get a really significant benefit. So if you're doing nothing and you just start doing a little, and I'll tell you how much a little is, you see these dramatic decreases in the hazard ratio of mortality. And it's the law of the more you do, the better the benefit, but you get a diminishing return when you get out here. And this is where Devin lives, out here in this area with activity. And this is where Mandy, that's me, lives activity, right? We're all in our different spheres of existence. But I think it's important to note that at levels of activity significantly lower than that 150 minutes, which is the recommendation, we can still see a significant benefit. And I think that's the message that needs to get out there, that if you're not doing anything, or even if you're doing a little bit, doing more is going to be a dramatic benefit to your overall health. And so how much more do you have to do? Put this in terms that we understand. So if we want to get to about a 25% reduction in hazard ratio, that's walking at a 2 to 3 mile per hour pace for 20 minutes a day, 5 days a week. And I think that's something that most of us can do. And if you cut that in half and you only do 50 minutes a week, so however you want to break that up, you still see a 20% reduction. And so the message I'm trying to get, if you're not doing it, get out there. If you're not doing anything, doing a little bit more will give you a significant benefit to your health. And that this goal of 150 minutes of moderate physical activity is great, but if you can get to that, but just get to where you can, and you're going to see a benefit. Okay, so that's how much we really need. The next thing I want to talk about is sitting. We all spend a lot of our lives sitting, even those who are very physically active. My husband is a systems administrator, so what does he do all day? He sits in front of a computer like most of us do. We all sit a lot. And so the question is, can we overcome the negative effects of sitting too much with exercise? And the hopeful message is yes. And maybe some of you have heard the opposite. Maybe some of you have been told that if you sit a lot, there's just no hope, because that's what they were saying 5 years ago, that there was nothing that we could do to overcome the negative health consequences of sitting too much. But we have re-examined the data, and we have a much more hopeful picture of what can happen. And so you look at this heat map, and you look at, this is moderate to vigorous physical activity levels, obviously increasing as we move to the right, and sitting time increasing as we move up. And what this graph is showing us is that if you sit all day and you do nothing physically active, you're in the red zone. And the red zone would be a zone you don't want to be in. That's where there are some significant health consequences of being sedentary. But as you increase the amount of physical activity you do, you slowly move out of that red zone and into kind of the yellow zone, and eventually into the green zone. Even if you're sitting for a lot every day, if you do a lot of physical activity, you can be in the green zone when it comes to your health. And so again, the hopeful message is do what you can. Now, I wish we had data where we could say exactly how many hours of sitting and actually how many hours of physical activity we need to correspond to these different points. We don't have that exact data yet, but the overall message is that yes, we can overcome the negative effects of sitting too much, and we do that by being physically active. And this again is from the Physical Activity Guidelines for Americans, 2nd edition. Okay, any questions on any of that? I'm moving pretty quickly because I just have a lot of fun stuff to talk about. Yes, please.
So if you're using a standing desk and you're doing a lot of standing, can there be negative impacts with the standing piece, or does that help to offset the sitting piece?
Okay, so a standing desk is not going to burn more calories. So if you're trying to burn more calories by standing up, it's not. When we have an increase in energy expenditure is as we transition from sitting to standing, or standing to sitting, not as much. But a standing desk is good because it can help with posture, and if you're kind of moving back and forth, then you're also getting some increase in energy expenditure. And so standing desks, if they're comfortable, by all means use them. Yes, they can be very beneficial, and they can help with this. Yeah. Any other questions? I have some colleagues in the audience, and if I say anything wrong, go ahead and correct me or add to it. But I'm probably not wrong, right? Okay, so exercise prescription, and this is the class that I teach on campus. We talk a lot about how do we develop exercise programs for an individual. And so one of the important things is to determine the intensity level of a given exercise. And how do you do that? And there's a couple of really easy ways to determine intensity. And I think the easiest one is to use a talk test. And this has been used for 100 years. It was developed by individuals who were running, and they used it to figure out what their intensity was. But if it's a light intensity, then you can easily speak. If it's a moderate intensity, you can have a normal conversation, but with a little bit more effort. And you know when you've gotten to a vigorous intensity when talking becomes difficult or impossible. Anytime I run, I just went on I do like a little half-mile run in the neighborhood with my daughter some mornings as she warms up for her basketball drills. And she always wants to talk to me, and she's just talking and talking and talking. Anytime I run, I can't say anything. And I'm just like, Tessa, I can talk to you when we're done. So I know I'm in the vigorous zone, right? So that's an easy way to know what your intensity is. I'm not sure why we're shaking. Okay. Another way is to use an RPE scale. And this is the RPE scale that we often use in exercise sciences. It starts at 6 and it ends in 20, and that's really bizarre, isn't it? Okay, but there's a reason for it. And the reason is that when this was developed, they wanted to make the scale kind of correspond to heart rate levels. And so a 6 would correspond to a 60 heart rate. And this scale works great if you're 20 years old. But once you're past 20, then the heart rates don't exactly match up. But it is still useful in its weird, quirky kind of way. The next thing you can do is to calculate a target heart rate. And I'm sure this isn't new information, but target heart rate, you figure out what your maximal heart rate is. And maximal heart rate is the highest or the most often that your heart can beat. And so unfortunately, as we age, our heart rate max goes down. So we take the number 220 and we subtract our age, and then you multiply that by a percentage intensity to get your target heart rate. And right here are some values for the different heart rate zones. A light would be 59 or lower, moderate is 60 to 80, and vigorous is anything greater than 80%. And so you can, if you have a watch or something that can measure heart rate, you can use heart rate to know where your intensity is. And then if you just want to walk, remember walking is our best medicine. A light walking speed, and this is individually specific. Some individuals this may vary, but in general, for a light intensity, walking 2 miles per hour, moderate is 3 miles per hour, and vigorous is walking at 4 miles per hour, or anything running would give you an intensity level. And so why do we care about intensity? Well, intensity turns out to be very important, and it turns out that intensity may even be more important than duration. Intensity really matters when we're talking about our all-cause mortality risk. The more intense you can do an exercise, the greater the overload on the body, and the greater the overload on the body, the greater the adaptation, and the greater the adaptation, the better your health will be. And so if some people really like high intensity exercise because they can do it for a very short period of time, and time is the #1 barrier to exercise adherence. Some people don't like high intensity because guess what? It's high intensity and it hurts and it's not fun. And so I'm going to show you a study where they did high intensity walking. So there's always a way to incorporate something into walking. And so this was an interval walking study, and it was done with type 2 diabetic patients, and they had 2 groups. And one group, well, they all did 4 months of training, 5 days a week, 60 minutes a day. That's a lot of training. But one group did a 3-minute fast walk, 70% of their max heart rate, we'll just say. And then they did 3 minutes of a slow walk at below 70% of their max heart rate. And then the other group just did 55% for the entire time that they were walking. So you have an interval group where they're going back and forth between a higher intensity of walking and a slower intensity of walking. And then this group is just moderate, continuous the whole time. And lo and behold, what they found was that the interval group had greater health benefits. They had a better glycemic control, meaning they were able to control their blood sugar levels better than the moderate group. And they also had a greater improvement in aerobic fitness, and they had greater results when it came to adiposity and body mass. Question.
How would terrain affect that? Let's say you're going to go.
Yeah, so absolutely. That would be an easy way to make your walking program more difficult, is to find some hills and go up the hill. Your heart rate goes up. You're at a higher intensity. and then go down the hill or go flat, and then you can recover. And so, yes, that's a great way to incorporate it. And so this is just kind of an example of how we can throw some high intensity in without it being, you know, the HIIT workouts that you see the really young fit people do that just don't look fun to me. Maybe they look fun. Okay, so I mentioned this earlier. We've spent a lot of time talking about aerobic fitness. It turns out that strength muscular fitness is just as important. And I always ask my class the question, when you're working with your clients, which is better? Should you focus on aerobic or should you focus on strength training? And I get a variety of answers. And one of the best answers is when they say, whatever my client will do. Right? That is the best answer. So which is better for you? Whichever one you will do and keep doing regularly. But it turns out that if you can combine the two, the benefits are even greater. There's kind of a synergistic effect that the combination of muscle and aerobic exercise yields greater benefits than either one alone, because they're targeting different systems and they're overloading different systems in your body, and you're receiving that benefit. Yes.
Would the combination be like alternating days or like doing both the same day?
And the answer to that is yes, whatever you will do. And so, yes, some people, they only want to work out for 30 minutes. So maybe 3 days a week they do aerobic and 2 days they do some type of muscle strengthening. I like to combine it all in one day and do a little bit of each, but whatever you will do is going to be the best for you. So yes. Okay, this is a really busy slide, but I really love it because it illustrates all of the benefits of exercise. And so when we move our muscles, either through aerobic activity or weightlifting, strength training, muscle strengthening exercises, when we move our muscles in a physical activity way, we release all kinds of little hormones that are called myokines. And myokines are a fun word for cytokine. And if you know anything about the immune system, cytokines are hormones of the immune system that send signals to different parts of the body to do different things. Well, when we exercise, we release myokines, and they go to every tissue in the body, and they have positive health benefits. So the little names here aren't important, but these are just the specific types of myokines. And this really, you know, we know this much, and there's this much to know. But we see benefit on the brain. We see a benefit on our adiposity. We see a benefit on our immune system. We see a benefit on other hormone systems. We see a benefit on our gastrointestinal tract, our gut, benefit on the pancreas, and that's important for type 2 diabetes, on the liver, on bones, blood vessels. We grow more blood vessels, we rejuvenate the ones we have. And then this is the best one of all. Exercise will even make you look better. It will even affect the mitochondria in your skin cells, and it will make your skin cells younger and healthier. And so it improves aging skin. So you can see that if we could take everything that exercise can do and put it into a pill and market that pill, we would be trillionaires, because everybody wants to take a pill, and we have pills for a lot of different diseases and a lot of different conditions, and they're necessary and they're important. But each one of those pills targets a very specific system or specific cell or a specific protein. Exercise does it all, and it does it all in ways that we don't even fully comprehend. And so exercise really is medicine. Exercise really is the wonder drug. Okay, let's talk about exercise and its effect on the immune system. So when we start to talk about disease and we start to talk about chronic disease, non-communicable diseases, underlying all of those diseases, cardiovascular disease, diabetes, arthritis, Alzheimer's, dementia, mental illness. Underlying all of those diseases is a chronic low-grade inflammation. So the immune system, the innate immune system, when we chronically overstimulate that underlies the pathology for all of these diseases. And so we start to have immune dysregulation. And there are a couple of factors that contribute to this immune dysregulation. Obviously, physical inactivity is what we're talking about here, but also diet a poor diet can contribute to immune dysregulation, stress, being chronically stressed. And then, of course, as we age, our immune system ages, our whole body ages, and that can contribute to immune dysregulation. And then that immune dysregulation increases our risk for an infection. So we saw this with the COVID virus, that individuals who were more physically active, when we look at broad public health epidemiology, not at a single individual, when we look at those, we saw that individuals who were more physically active were less susceptible to severe COVID infection. Now, I'm sure all of you know someone who was just as healthy as could be and still suffered from COVID. There will always be exceptions, but on a broad scale, increasing levels of physical activity reduced that. We reduced our autoimmune diseases, rheumatoid arthritis, multiple sclerosis, lupus. We reduce, or rather with immune dysregulation that leads to these things. Leads to type 2 diabetes, it leads to cardiovascular disease, it leads to cancer or can contribute to cancer, and it can contribute to mental illness. And so this immune dysregulation really underscores all of these diseases. And so what is the great benefit of exercise? And this is kind of a running joke in my class, because every time I say what's a benefit of exercise on one of these diseases, if my students will raise their hand and say it lowers inflammation, they always got at least one benefit right, because exercise will improve immune function and it will get rid of some of this chronic low-grade inflammation. So exercise, we get rid of our chronic low-grade inflammation. When we talk about cancer, what is the role of the immune system in cancer? Well, if we have a healthy immune system, we have improved surveillance. And so the immune system cells travel through the body and they can find tumors and they can start to fight tumors. And so that's the benefit of exercise. And we have increased anti-tumor immunity. And I wish I could go through all the physiology of that with you, but you would probably be bored, but it's exciting stuff. We decrease our occurrence and severity of illnesses and infections. Something else that exercise can do for the immune system is there have been a couple of studies recently that have shown that if you exercise either immediately before or immediately after getting a vaccination, that stimulates the immune system and you have a more robust response to that vaccination, meaning your body produces more antibodies, which is the goal of immunization. And so we can improve vaccine efficacy in a short term with just a small bout of exercise. As we age, our immune system undergoes immunosenescence, which is just the aging of the immune system, and exercise can help combat that and improve that. And then the immune system interacting with our gut microbiome is really important. And again, I wish I had the time to go into some of the physiology of that, but I don't. But know that exercise improves the gut microbiome, and the gut microbiome is essential to good health, a healthy microbiome. Okay, let's talk about blood pressure for a second. When we talk about blood pressure and exercise, we know that long-term, being physically active, we see a decrease in blood pressure, but we also can see a short-term or acute benefit of exercise on blood pressure. But just for some numbers here, what is high blood pressure? Anything greater than 130 millimeters of mercury for systolic, and anything greater than 80 for diastolic is considered stage 1 hypertension. And 50% of the American population has stage 1 or higher blood pressure. And then they've added this other category of elevated, anything greater than 120. We know that that's kind of a probationary period, and a lot of people who have an elevated blood pressure will, in a couple of years, fall into these categories here. So there's a lot of people with high blood pressure. That's the not so good news, but again, our message of hope is that as we exercise, we can use exercise to help control that blood pressure and not rely on medication only. There's something called post-exercise hypotension, and this is an immediate effect of exercise on blood pressure, and it's really quite dramatic. For individuals who are hypertensive, they will see a reduction in their blood pressure for 12 hours following a bout of exercise. So if you do a small bout of exercise, if you have high blood pressure and you do a small bout of exercise every day, you're essentially lowering your blood pressure for 12 hours every day after that bout of exercise. Very important. The response also occurs for those who are in the normotensive range. The response is not quite as long, but when we talk about a reduction in blood pressure, how much is not insignificant. 20 millimeters of mercury reduction in systolic blood pressure for up to 12 hours after a short bout of exercise. That's pretty dramatic. And of course, the reductions are going to be proportional to the intensity and how long you do it. A higher intensity and a longer duration will give the maximal benefit. Okay, I'm running out of time. So real quickly, exercise benefits on diabetes. This is a lot of the physiology that occurs. And we don't have time to talk about that, but exercise does improve diabetes, better glucose control, a lower medication requirement are some of the benefits that someone can expect from doing regular physical activity. One of the great things about exercise and its effect on diabetes is that when we exercise, we need glucose to come out of the blood and get into the cells to be used. And in a normal situation, when we're not exercising, we have to have the hormone insulin to signal that. But when we exercise, we don't have insulin signaling. The cells recognize that they need glucose and they pull it in. And so when we exercise, we give our body a break from insulin, and it's chronic insulin overstimulation that can contribute to type 2 diabetes. So exercise, there are a lot of benefits, exercise on diabetes. Okay. Exercise and the brain. So we know that when we exercise, it improves cognition, it improves attention, it improves executive functioning, which is our ability to prioritize and complete tasks. It also has a benefit on mental health. It also has a benefit on some of the diseases like Alzheimer's, dementia, and Parkinson's disease. And some of the physiology behind that is that when we exercise, that stimulates the growth of new nerve cells in the brain and throughout the nervous system. We call that neurogenesis. We decrease inflammation that may be occurring in our nervous system. We improve synaptogenesis, and that's kind of a fun word to say. And what is synaptogenesis? This is dopamine being released from one nerve ending and traveling to the next nerve ending as a signal. And when we exercise, we increase our levels of dopamine, we increase our levels of dopamine receptors. And so we have better synaptogenesis. And the last effect is that when we exercise, that stimulates an increase in new blood vessel formation, and also repairing damaged blood vessels, and we call that angiogenesis. And I have some of the physiology behind that, but we won't go into that because we're out of time. So I want you to take a minute and maybe tell me, what are some of the barriers that you experience towards exercise? What are your barriers to exercise?
Joint pain.
Joint pain, okay. And yes, go ahead. Time's the number one. Joint pain is a significant barrier to overcome. And There is research to suggest that as we exercise, our pain levels come down because our brain rewires and some of the physiology changes. But at a given point we get to a point where there's just going to be pain with exercise. Back here.
So we have a lot of autoimmune issues in our family, and I just like, how do you overcome the barrier of just chronic fatigue? Like you just can't hardly even get out of bed. So how do you say, yeah, now let's exercise because you haven't slept or whatever because of the autoimmune stuff?
That is the $1 million question, right? So it sounds all good on paper, but how do we actually implement it? And when you don't even have the energy to get up and make yourself a piece of toast, how do you then have the energy to exercise? And that is a great question. And the only answer I have to that is to do as much as you can, even if it's a little bit, even if it's a walk around the block. And recognize too that on any given day, you may be able to do more than on another day, and to be gentle with yourself and recognize today, I just can't do it. But if I do it tomorrow, that'll be fine. And I'll do as much as I can. And so just that same idea of everything you do counts, and don't look at what you haven't done, just look at what you have done. But that's a hard one to navigate, definitely. Someone over here, go ahead.
I think motivation.
Yeah, so motivation's a big one. And how do we help with that motivation? For me, every time I study about the benefits of exercise, that motivates me, and I almost get up immediately and go do something, right? And so I have a great line of work where I'm constantly being motivated. But some of the other ways that we can motivate ourselves is to make it social, include family and friends. Nobody wants to go down into a dark basement and lift weights all by themselves, except maybe my husband. But if you're doing it with a friend, if you're doing it with a family member, if you're fine, the other thing is to choose activities that you enjoy. If going down in the basement and lifting weights all by yourself, heavy weights is not your thing, maybe pickleball is, or maybe walking around the block or playing Frisbee or those types of things. So motivation, that's a big one. Yes.
Share an idea. My mom, she contacts the people she ministers to, and they go walking in the mornings, and it's 2 birds with 1 stone. She gets to minister, gets to know somebody. She also gets her walking done for the day, and so she feels good and in 2 different ways. That's
Yeah, absolutely. And so she's got the social aspect, because I know when I exercise, I want to be with friends. So I love hiking, and I always organize hiking groups, and we go hiking together. And I've learned that it's almost more for the social and the relationships. It's also for the physical activity, and I love nature, but the social and the relationships always rises to the top. So any other barriers that you have to exercise? Yes, in the back.
This is so lame, but just like having to put on my exercise clothes, I feel like that just takes so much effort. And then afterwards, like, then you're sweaty and gross, and then you have to get your clothes. I just, like, that's really a big barrier for me.
I hear you on that one. So my mother, I'll just throw her under the bus, grew up in the era when you never left the house unless you dressed and had your makeup on and your hair done. And so that's a very big barrier for her. For me, I grew up in the era where we didn't care as much, right? It's kind of the same area you grew up in, but it's still a barrier because you don't want to be hot and sweaty. And so one trick that I found is I try to, on days when I want to be physically active and want to exercise, I try to dress in clothes that can go both ways, that I can do something easy with physical activity, but I also can be dressed for the day. And then that eliminates it for me. I don't sweat a lot, so I don't have to worry about taking a shower till the end of the day. But that would be a barrier. So finding a way around that. So first one here, tips for starting a new exercise program. Don't try to go from nothing to, I'm going to start this new program. I'm going to do a half an hour a day, and I'm going to do that 5 days a week, because I guarantee you will fail. Unless you're a type A personality, and once you decide to do it, then you're all gung-ho. But most of us aren't that. So start with a little and make incremental changes. Start with something that you enjoy and that you can make it a part of your lifestyle, and include family and friends for motivation. And then just remember, just like our great apostle friend, Elder Holland says, everything you do counts when it comes to ministering. Everything you do counts when it comes to your physical health, as far as moving your body. Everything you do counts. And that's all I have. So do you have any other questions for me? Oh, she's just scratching her head. Yeah, so she does have a question.
Share some more about this YB Fit Health Coaching information.
Yes, thank you for reminding me. I wanted to do that. So YB Fit is a program down in the Richards Building, and they do health coaching. And so you meet with a student who's been trained as a health coach, and they will go through a full wellness interview with you. They'll help you to decide on they'll give you information for exercise and setting up an exercise program. They'll give you a little bit of information on diet, but just kind of an overall wellness health coaching experience. They'll do some tests to kind of see where you are as far as your baseline, and then it's a great program. I don't know. Is there anything else to add on the YB Fit, Lance? No? Okay.
I'll add something on.
Oh, Cammy.
The MBA will pay for it.
Okay, so DMBA will pay for it. So free health coaching. So if you know what health coaching is, that's what YB Fit's doing. And it really is a great program because it's here on campus and they meet with you regularly to help you set goals and then to achieve those goals. Yes.
Here, it still says there's a copay.
Okay.
It's not completely.
Come out of your copay, sorry.
Okay, there's a copay. Cammy led me astray.
I'm sorry.
Small copay, but yeah. Other questions? Okay, well, thank you for your time. Get out there, go on a walk.